So Tony Pollard didn't practice at all this week. They're still listing him as questionable with a foot injury, and that doesn't seem too optimistic to me. There's not that much definite data on it, but I feel like it's rare that we see a player that hasn't practiced all week still suit up. There's a couple different foot injuries it could be. So that's that first metatarsal that's highlighted right there. And sometimes you can have a stress reaction. That's usually the most common one because it's the biggest weight bearing. Stress reaction happens in a fracture forming underneath the hard bony surface. So you can't see it on x-ray, but you can see it on MRI. The other thing it can be is we talked about a midfoot sprain, which connects those metatarsals to the midfoot. And then the last thing it can be in a foot injury is it can be plantar fasciitis. So the plantar fascia is highlighted right there. We talked about stress reactions before as well. It could also be of the heel bone or occasionally, less commonly, in that fifth metatarsal, so all the way on the outside. Without knowing any information about it, it's typically not turf toe, which is outlined there, because then they usually call it a toe injury. So overall, it's probably a very, very mild sprain of the foot, possibly plantar fasciitis, and in some situations, a stress reaction. But if it was a stress reaction or a stress fracture, there would likely be some reports of Pollard being in a boot, and I don't think we have a report of that. But either way, this whole differential is to go through the fact that if he hasn't practiced at all, I just think it's unlikely that he plays. The thing is that he does have a backup in Julius Chestnut, and his game slot is at 1 p.m., so you can afford to wait and see. Julius Chestnut's owned in about 2% of leagues, so if you have Pollard, he's worth a stash just in case you don't have any other backup options. Jordan Love had that groin injury. He was able to log limited practices on Thursday and Friday, and it does seem like he's going to be game time decision, but even with the Packers' conservative history, it sounds like they're leaning towards him playing. The adductor longus is shown right there. That's the most commonly injured groin muscle, and adductor muscles recover quicker than hamstring strains, and there's a couple different reasons for that. One is you can see it only crosses one joint line, where hamstrings cross two joint lines. As well, adductor muscles are involved in less explosive muscle movements, so that allows for quicker healing, and there's a better blood supply as well. So when you have an adductor strain, you have the pudendal artery as well as the superficial femoral artery, and those provide a much better supply. Also, we talked about the hamstrings, how they have a more significant tendon composition, and in addition, the hamstring muscles have more explosive fast twitch muscle fibers, which recover slower, ironically. And the adductor muscles, they have a higher composition of slow twitch muscle fibers. With that being said, Jordan Love is a great quarterback, and there's not many other options, but you can always put in the comments if you feel like you have a dilemma to be made. But there's the artery supply. You can see how closely it overlies to those adductor muscles there. So Puka Nacua aggravated a knee injury on Thursday. They didn't specify which knee injury he aggravated, but they did say there's no structural damage. So he has two knee injuries. He has the bursa issue, which are these circles that are outlined on the knee. The one right over the kneecap is the prepatellar bursa. That's the most commonly injured one. And then he also had a posterior collateral ligament, which is not shown here. It's inside the knee. They said that there's no structural damage, meaning likely that they did an MRI to make sure that there is no worsened tearing of that PCL. It's almost certainly not completely healed, so we've talked about how there is some concern for further instability throughout this season, but it does sound like early reports say that he is going to be likely playing on Sunday. So that leads us more to say that it's more likely to be this prepatellar bursitis that's acting up, and he likely took a direct blow to his knee, and that can inflame that bursa sac. So when that happens, the prepatellar bursa, as outlined there, becomes inflamed and swollen, and it does restrict the range of motion a little bit. In the acute setting, you can actually go in there with a needle and a syringe and you can draw the fluid off. But if you don't do anything outside of that, the fluid typically reaccumulates because you're not doing anything to treat the cause of that inflammation. So what you can also do there is you can provide a compression wrap around there to prevent there from being space to allow that bursa to fill up with fluid again. You can also inject some steroid in there. And the steroid is a direct anti-inflammatory medication that helps reduce the outlet of inflammatory factors and reduces recurrent swelling. You also have to do physical therapy to help the recurrence of onset of this prepatellar bursitis, because it is an issue that you need to deal with the onset of inflammation, usually to the accompanying tendons or ligaments in that area. We can talk a little bit about Brian Robinson Jr. Sounds like he has an unspecified knee injury, but he's been practicing all week. He's also been a stud going throughout the season, so I would imagine that he's active. Typically, when you have an unspecified knee injury, it's either a knee contusion, meaning a knee bruise, or a possible mild MCL that you're able to play through. They haven't released any indication of him trending in a bad direction, and with how strong he's been of a play this season, I wouldn't be looking for an alternative option based on the news thus far. If anything happens, that I'll be sure to keep you updated. But as of right now, it seems like it's a general knee contusion, knee bruise, or possible mild MCL. But with him practicing, that leads me to think that he will be playing this weekend, and I wouldn't be trying to pivot away from him.